Welcome into Wisecarver Solutions Medicare Basics. We're going to cover just the basics overview of Medicare. This is for people who are aging in, turning 65, maybe a loved one doing research for mom and dad, or maybe you're a recipient who's just not clear about all of these changes happening to Medicare year to year, and you just want a little bit of help with some education. So here we go. We have original Medicare is Part A and Part B. We have Part C, which is Medicare Advantage plan. This is also known as all-in-one because it covers Part A and B, and prescription drugs, Part D. And so we have a couple of different ways of having coverage, but Part A is for hospital. If you've been working, you've been paying into that, and so there's no premium for that. There could be a situation where if you haven't been paying or haven't been working, you haven't been paying into it, you may have a premium that you can apply for. And basically, that means that if you go to the hospital, you have a deductible, $1,700 plus, and then that's good for 60 days, basically. And so, whatever happens in those 60 days, if you go to the hospital again, or whatever happens, whatever occurs in the hospital, then you'll be charged 20% of whatever the cost. Medicare covers 80%. That's Part A. Part B works very similar. But this year, the premium for Part B is $202.90. So $200 a month, and that's usually taken right out of your Social Security if you coordinate your retirement and when you're turn 65. If you want to delay that, you need to prove that you've had that coverage. But that's basically Part B premium, just over $200, and you'll have a smaller deductible, just a couple $100, 283. And then once you meet that, then you pay 20%. Medicare covers 80% of your doctor visits or outpatient things that are covered in Medicare. Anything that's like not cosmetic, medically necessary things, including durable medical equipment. Okay, so that's A and B, and that's kind of how that's funded, right? Let's see. There are two options, two pathways to get coverage. One, we mentioned Medicare Advantage, but let's talk about the supplement plan. The supplement plan is optimal if you are moving around a lot, you don't want to deal with networks, and you can afford it. So supplements, you pay a premium every single month. And by the way, as you age, your risk factor goes up for medical coverage. And so your premium will go up year to year. It's usually doesn't change for the first 3 years, but then it may go up quite a bit, actually. So you just need to be aware of that. And outside of that first year, you may or may not be able to get into a supplement plan. So there's kind of a caveat there, depending on medical issues. So something to think about. Or you could have a higher premium depending on medical issues. So once you have your supplement plan, and there's different variations of that, then you would basically have a deductible, or sometimes there's no deductible, depending on the plan, depending on how much premium you're willing to pay, and then that gap, that 20% gap that Medicare doesn't cover, will be covered ultimately. And so there's different lower or higher deductible plans available to you. But that's the point of those plans. It's Medigap, also known as supplement plans, and those would be like plans like K, G, L, F is one that you probably won't be able to get into. You had to have been eligible prior to 2020 in order for that to happen. So there's just several different plans and many carriers that you can choose from. So there's a lot of options there. If you have a supplement plan, you also need a prescription drug plan. This is part D. Basically, you need to have some sort of drug coverage. And so there's a standalone plan that you can get, and just depending on plan, I think a national average recently was about $50. Some are less, some are much more. All formularies in those plans are slightly different. So you may have one medication that is in a higher tier in a different formulary, different plan. So that's why it's good to gather all of your information, doctors and medications, to see what's going to be a good fit. Not so much the doctors if you're going to go in a supplement plan, because you can go to any doctor as long as they take Medicare. So the other type of coverage is a Medicare Advantage plan, and this actually takes place instead of Medicare. You actually have this private insurance company Medicare plan. So you do have to have A and B in order to um, uh, in order to qualify, sorry, for the plan. So you have to have those in place to get a Medicare Advantage plan. But this plan takes place of. So the supplement and original A&B work together, but this is a separate thing. So now the rules are all basically what is in the plan. This is an all-in-one plan, so you can have Medicare or medications covered as well. It includes a formulary for prescription drugs. It may or may not have a deductible, medical deductible. It's probably not going to have a premium. There's usually no premium options, but there's give and take in all different levels of co-pays out of pocket. There's networks involved. So some of them are closed networks. That would be a HMO, um, uh, health management organization, or a PPO would allow you to go in network or out of network. But if you go out of network, you're probably going to have a higher copay. That's a preferred provider organization. So those are network issues. Basically, what we'd do is take an assessment, information such as your doctors, this comes into play. So now we can see, okay, well, in these plans, we have a whole list of carriers, whole list of plans, and we can say, okay, these are all green light. You can see all of your doctors, all your medications are in, and if there's a problem, we need to address those individually, and then decide, what's going to be more important to you, because this one plan has things. Let me back up a little bit. Medicare Advantage plans also have extras to them. And so the way that it works is basically it is a coordinated plan, the private company with Medicare, and they approve of these plans, and Medicare will actually pay the company for an enrollment. When somebody enrolls into that plan, they pay the company to help bolster some of the services available. So we get things like dental, vision, hearing, gym membership, sometimes transportation, chiropractic, foot care, different kinds of things like that. And there's going to be different levels to them, depending on the plan. Some plan will say, okay, well, let's diminish all of these things, but let's do a give back option, and so they may have several plans available that have more dental, less of these other things. So it's a matter of figuring out what is going to make most sense for you, for your coverage, the likelihood that you're going to be utilizing one plan over the other. Where is the highest value according to your needs? This is why we need to do a full assessment, have a full Medicare conversation in order to flush out all of these details, so you can be guided into maybe one or two options, and then it's a matter of weighing out priorities. So that is kind of the whole process of everything. And it makes life so much easier when you have one agent to go over all this information, and then help through that person. Me, I'm saying, if I could be your agent, I would help you throughout the year, not just solve this one problem, but throughout the year with as anything else arises, right? And then the next October, because we have the annual enrollment period, you get a annual notice of change where there's plan changes. There's also Medicare policy rules and things like that that change year to year. You'll find that your premiums go up based on Medicare rules and these kinds of things, you know. So it's good to have somebody that's going to basically just update your information year to year and do this assessment again, figure out, okay, what's changed. If nothing's changed, okay, let's look at our options. You may end up just staying in the same plan if that's going to be the plan that serves you best, or there may be a better option. And so anymore, there's a ton of uh, marketing agents and uh, different commercials and things like that available. So there's a lot of engagement. Every time you speak to somebody, you have to go through this whole process of sharing enough information where you can make a sound decision. And if you're kind of pulling back and not divulging things, then we may actually skip something that could become problematic down the road. So you want to be, kind of open book with your agent, and then ongoing. If you just have that one conversation, it just makes life easier. So if you would like to talk to me and see if we can help you out, if you have any questions specifically, you don't want to put it below, that's okay. I get it. Just reach out to me directly. My cell phone is 360-846-8200. I'd be more than happy to help you or your loved one, or maybe you're just planning, you're turning 65 and you're just like, give me the heads up. What do I need to be looking for? Because in that case, you have a 7-month window that we need to be aware of. And then a certain number of things either need to happen, or if you have something else in play, that's great, but we need to kind of talk through those things. So again, give me a call, 360-846-8200. Talk to you soon. Bye.